Growing a small business is exciting, but it can also get confusing fast when the numbers start pulling you in different directions. Robinson Aquino, CEO of JBS Corp. And author of The Small Business Money Game, created this book to help business owners better understand their finances, spot the growth plateaus before they become roadblocks, and make smarter decisions as they scale. To celebrate the launch, Robinson is giving away free copies of his brand new book. Want one? Go to thecovertcode.com to learn more.
Aloha. My name is Annu Navani. I'm coming to you from my battleship here on the beautiful island of Oahu. This week on the Covert Code, the topic is the future of healthcare. My very special guest is Dr. Annu Navani, founder and chief medical officer at Reve Health Institute, a double board certified physician, Stanford adjunct faculty member for 20 years, and the author of the Forbes upcoming book, Health Recoded, a physician's guide to intelligent healthcare. Today, we'll be discussing how AI, regenerative medicine, and intelligent healthcare systems are transforming the future of healing, longevity, and patient care, and what these innovations could mean for both doctors and patients in the years ahead. Thank you so much for being here today with me, Annu. To kick us off, can you give me the Cliff Notes version of the Annu story? How'd you get from where you were to where you are right now?
Yeah, absolutely, Anna. And thanks for having me in your show. Really appreciate it. It's been a beautiful journey of 23 years of practice. I did medical school in Calcutta, India, which I found out was the first medical school of Asia, believe it or not.
Wow.
And then I came to United States. I did research at UCSF and then did residency in anesthesiology in Wisconsin, fellowship in California in international pain management, and then started my journey as a faculty at Stanford, where I served for 20 plus years, establishing comprehensive programs in spine, orthopedic, and musculoskeletal care. And while I was doing that, I actually came out to the community as well and set up multidisciplinary clinics, which are now called Boomerang Healthcare. We have 22 of those in California. And alongside that, I got interested about 15 years ago in finding ways of preventing degeneration of spine and joints. So I started researching platelet-rich plasma and our own body's mesenchymal stem cells, and did a few things along those lines, like wrote the national guidelines and published the first book and randomized clinical trials. And, now that has evolved into Reve Health Institute, and I'm the founder and the chief medical officer of that, and it's a regenerative medicine and a longevity medicine institute. So that's my journey in short.
Wow, that's very impressive. And so, your book's coming out. What's your publication date?
It is October 24th to be precise.
Excellent. So I know people always ask me this. I'm going to ask it to you. Why now? Why have you always wanted to write a book? What prompted this book? And tell us about it.
Oh, yeah, absolutely. I think this is exactly the time we need this book because, our healthcare system is very fragmented. People are going to different centers to obtain different services. The cost of healthcare is high. Not everybody can afford it. And I think there is a little part that each one of us can do to make the healthcare system better in our country. And we lead by example, right? There are systems that do some things better in different countries and some, that don't. But I have put together this book that talks about emerging technologies and how we can use it at the point of care to our advantage while getting the best possible outcomes and bringing the costs of healthcare down. So there is something for everybody, all stakeholders in that book, including patients, healthcare providers, policymakers, industry, investors, you name it. So that's, I think the book couldn't be more timely.
Wow. So, and is there a framework you're talking about, or you're just kind of walking through, some of your favorite things that are coming out, or is there any more you want to share about it?
Absolutely. So I'm talking all about emerging technology in healthcare, starting from how we can leverage machine learning and AI to find the right patients for the right treatment, how we can use gene mapping to personalize care. Then there is a chapter on regenerative medicine and stem cell treatment to obtain cutting-edge therapies to not only solve the problems that health-related problems you may have, but also to prevent further degradation and degeneration. I also talk about CRISPR technology, CAR-T therapies for cancer, as well as some of the upcoming therapies like robotics, nanotechnology, bioprinting, and the whole goal behind this is to make sure patients are aware and empowered to be able to bring it up at their office visits with their physicians and, avail the care they need at the point of care, right? So I feel informed patient is an empowered patient. And if they can seek out the best treatment for themselves, then that's a battle half won already because people will be able to get the treatments. The big fragmentation we have currently is that we make a lot of advances in the lab, but we can translate it to the point of care in the clinics. So hopefully this will get us thinking in the right direction, and each of us will take this to the next level where we can converge and bridge that gap and establish a healthcare system that's offering the best possible care for the best possible outcome.
Absolutely. And why is it that a lot of these technologies are not making it? It always most reminds me in my industry as well of digital advertising. I went to speak when I launched my book. I went to Bentley and NYU to speak, and I was shocked. I knew that they're still not really teaching digital advertising. And, I down that journey of how long it takes textbooks to get updated and how long it takes to trickle down this new knowledge that we're acquiring into kind of public consumption or even what they're teaching people at school. Being a faculty member, adjunct faculty member at Stanford, is that something that you're also helping to influence, or why does it take so long, and why are these things getting stopped?
Yeah, great question, Anna. Actually, the multiple reasons why we are not able to translate it clinically. For one, the education system is lagging behind in terms of teaching about emerging technologies or practicality for that reason at the point of care, what's necessary now. So that's one. And there are quite a few publications that came out recently about how the teaching should change at the level of medical school residency programs and fellowships to kind of attain a more of that comprehensive overview and train the doctors in a better way so that they're offering more comprehensive integrated solutions at the point of care. That's one for sure. In terms of adoption of emerging technology, like I said, we can make huge advances in the lab, but it's pointless or it's not useful if it's not brought to practicality and for the patients who need to use it, right? So for that, I feel there are multiple reasons. There are regulatory barriers. There are socioeconomic barriers. There's also education and awareness barrier. And in order to kind of mitigate some of those challenges, I actually recently, last year, founded the World Institute of Regenerative Medicine, which is bringing in global leaders, scientists, clinicians, industry, investors, tech in one place. So we held a World Congress in San Francisco in April of this year, actually 2026, where we brought in 22 countries to talk about what are the barriers in your countries to take on precision medicine-based emerging technologies, longevity-based medicine technologies, or regenerative medicine technologies. How can we solve those problems to bring it at the point of care? So that's definitely one step we are taking to kind of get that addressed. But then the other thing is I'm also the president of American Society of Interventional Pain Physicians this year, which is one of the oldest interventional pain physician group established in 1998. And we are doing quite a bit of advocacy at the Capitol Hill level, as well as a lot of education among the students, residents, and physicians to make people aware of these emerging technologies so that people can then be the strongest force to talk about it and bring it at the point of care.
Yeah. And what are some of these big standouts of, you mentioned socioeconomic or sociocultural. What are some of those barriers? Why don't people want some of these technologies to what is the pushback? Is it religious? Like what are we hearing?
Some of it could be religious, but that's not all of it, I'll tell you. I think a lot of these therapies are not FDA approved, or they are not covered by the insurance companies. So patients have to pay cash for these treatments, and it's not affordable. So I feel, especially with longevity medicine, for example, or regenerative medicine, where we're using patients' own stem cells or growth factors to help heal or cure the problem, it may be the best therapy on earth, but it's applicable only to top 1% of the population who can actually afford it. And that breaks my heart at the point of care, because I have a patient sitting in front of me who absolutely needs the therapy, and I know it will be successful in that patient, but the patient just can't afford it. So that socioeconomic burden can actually really come in the way of, really solving the healthcare problem. And we are, as such, reactive providers, right? We let the disease happen, and then we find solutions like medications or surgeries to solve that problem. What I've really pointed out in this book is, let's shift the clock there, right? Let's become reactive. Let's become proactive physicians than reactive. Let's prevent these conditions from coming on. And particularly for me, it is a full circle, because I am the one who has done procedures and surgeries on people, and now I want to see what I can do to prevent these problems from coming on, and totally, come in at the front end and develop healthier lives so people can enjoy a great health span.
Absolutely. I think that's definitely the goal. I'm not sure if you're a big meditator, but I just was at Dr. Joe Dispenza's 1-week retreat, and it was shocking to learn how many people were being cured of cancer and all kinds of conditions from just, moving energy around in their body, from their mind. And so what are some of your favorite things that are coming out? What's the hottest longevity thing that you think people can start doing? Is there anything that people can do on their own at home to start, being on the verge of health?
Oh, definitely. I mean, it all starts at home, and it all starts in small baby steps, right? So just basic lifestyle choices, right? Thinking about what you're putting in your body, because really, if you look at the literature about gut microbiome, a lot of how you get defined in terms of your brain health, your heart health, or your overall resilience is based on what you are putting in your body in terms of your food. So just making sure you're eating a clean diet, and it's not restricting yourself and really changing your life a lot, but just making smart choices about what you eat and having a balanced diet, so to speak, and then exercising every day. And it could be as little as 10 minutes of walk 2 times a day, or 10 minutes of HIIT, high intensity exercises. That might be just what you need. So it's just diet, exercise, sleep, and stress. Like I say, those are the top 4 things to really address, in your own homes. And then, of course, providers like me will, if you're interested and want to know more about your health, there are providers like me who will offer you an entire panel of tests to see where your health is at this point, right? So we do biomarker testing, we do genetic profiling. There is also ways of aging your different organs right now, or age clocking, I should say. You can know how much is your brain aging? Is it aging faster than your heart? What is the current biological age of your different organs of your body compared to chronological age? So I may be 50 years old, but then my brain may be 38 and my heart may be 65. How do I bring all of that in alignment? Right? So it's one thing to find out what your body is really doing and speaking to you, but then we also have a series of things that we can do. For example, I do a lot of work with platelet-rich plasma or exosomes, or even stem cells, right? Or regenerative protein arrays. So these are all exciting therapies that we use growth factors, cytokines, vagal nerve stimulation to optimize your health and give you that prolonged lifespan as long as you can live, but in a healthier fashion, so you can live your fullest. Now, I can go on and on about that, but I'll stop here and let you ask some more questions if they
Yeah, I think that that's interesting. I do want to talk about, just the other day I was watching a program on Gaia, and it was about, how long they think people can really live.
Mm-hmm.
It was really interesting. They had in Time magazine, I think in 1933, they had a Chinese gentleman that they thought was maybe 200. I don't know if you've heard about him.
Yeah.
But yeah, okay. Yeah, or 200. He was either 189 or like 240. And he had like 100. He had 180 children. And I mean, it was pretty intense. But, people in Tibet who are living to well into 120, 130. What do you think in your terms of if we started now with all this new awareness and these new tools and what do you think that we should be expecting to live in the future? Like our new
Great question. I feel like at this point, we're able to attain 120 years is the max we know somebody can live. And I don't think we are at a point where we can increase the life cycle of somebody yet. But I think what we can do, and we have enough knowledge now based on the studies that have been done and publications that are coming out so rapidly, that we can actually map the chronic diseases or the risk factors. 10 to 20 years before you develop a chronic disease, there are proteins that spill in your blood that we can now pick up in terms of our testing. So we can predict the risk of somebody going to have a neurocognitive decline or a metabolic condition and things like that, and take precautionary measures so they can live however long they would want to live or could live, but then live in a healthy fashion so that they're functional and have the maximized quality of life till the very end. I think it's not so much expanding the number of years. It's about, like they say, adding life to those years, right? Living a full and healthy and functional life.
Sure. So let's regroup on the cost, because I think that this is one of the industries where really AI has a huge opportunity to decrease costs of healthcare overall, right? Just in terms of being able to, instead of having to do all this blood work, as a for instance, or guessing on what's wrong with someone, now if we were able to use AI to kind of screen through, then it could really bring the cost of misdiagnosis down. Talk to me about that and what you think the industry is going to do.
Yeah, absolutely. I think AI is a huge plus as long as we use it effectively and in conjunction to our clinical expertise. So we actually have incorporated quite a bit of AI in our practice in terms of not only patient selection and practice management tools, but also in terms of, developing AI-guided analytics, right, to develop deeply personalized and predictive health plans for people. So we have, a database where we actually input biomarker data, the imaging data, healthcare lifestyle behavior data, and we then assign a healthcare score to an individual or patient who comes in. And then we, through AI, via some N-on-1 trials that we have put in place, the algorithms for, we develop a protocol for them that's specific to their needs, based on their risk factors, based on their family history, based on their own medical issues, and so on. And we carry them through the journey, and then we, at the end of the interventions that we would do, say a stem cell therapy or, say RPA, regenerative protein array therapy protocol that we put in place, we then re-identify those biomarkers and retest them and see if we have made a difference. And that then kind of keeps collecting in our system. And as we have more and more patients, it becomes more and more intelligent to kind of give us more accurate feedback on those patients. So I think AI can be used in so many different ways, but just predictive analytic tools in terms of developing healthcare scores, identifying the patients correctly, identifying the treatments correctly, and of course, never autonomously, right? It's just in conjunction with our own healthcare decision-making from our knowledge and experience. I think it can be very, very helpful. Also, something has to be said about not doing huge clinical trials or decreasing the need of huge clinical trials that cost a lot of money, but trying to do N-of-1 trial now because of the personalized data that we have on people. And, I strongly believe that every treatment should be personalized for an individual. It cannot be, cookie cutter approach where one size fits all. And that's a huge draw in our practice, where we make sure that each individual is kind of has a plan of their own based on what they really need, and following up with them from the beginning through the end to make sure they've kind of reached their journey, or the destination, I should say, through the journey.
It's really interesting to say that. I think you're 100% right. So I'm half Swedish. And in Sweden, when you get sick, they ask you how much you weigh, right? And then when you go to the doctor, they'll be like, okay, you're going to take half of this pill, right? Because you weigh like half of what the man weighs, right? And I actually, when I was 17, I was living in Colorado, but I got this. I was actually here in Hawaii on vacation. I love to touch things. I guess I was touching a plant, like a tree. It was beautiful, and I was experiencing it. And then I touched my skin, and I got this really bad rash, right? And I get back to Aspen, and it's getting worse and worse. I thought maybe it was a spider bite or something, and then I started hallucinating, and I'm like I'm seeing things move around, like, Mom, I need to go to the hospital. And it was some really bad allergy, and they gave me all these steroids, but they gave me so many steroids that it burned a hole in my stomach because I was a tiny little girl, right? And my doctor in Aspen was livid that they had given me the same medication that I was 100 pounds, that they would give to anyone. So I think that it's really interesting that what you're saying. I agree 100% that it should be personalized. And what do you think are some of the other barriers that exist in our healthcare system today that might be pushbacks on the future of healthcare in terms of what we're talking about?
Yeah, absolutely. Just to close off with the thought that you had in terms of personalization, trained as an anesthesiologist, everything that we administer to the patient during anesthesia is weighed milligram per kilogram per minute, or whatever the diffusion rate is. Right. So, expanding on that, yes, absolutely has to be dosed right, and dosed based on the genetic makeup of the patient, right? So how are they going to metabolize a particular drug and so on. But in my books, being a regenerative and longevity medicine physician, I do not even want to give medications to patients. I want to prevent the condition. I often say to my patients and to my colleagues, let's find it, fix it, and move it, right? So let's find the problem, fix the problem, and in spine and orthopedics, it's all about moving that joint, moving the spine, and being active and so on. So we have developed this fun phrase, so to speak, find it, fix it, and move it. Coming back to your question about challenges in our healthcare system, several. One is the slow process of approval for therapies. Thankfully, FDA has a RMAT process now where certain therapies can go through a rapid authorization process, even for clinical trials, so that's helpful. However, it takes 10 to 20 years to get a drug to the market, or any new product to the market. And
then how come we have so many? That's shocking.
I know. And, they make exceptions, right? For example, during COVID, the vaccines came out quickly to the market and so on. But I wish there could be a faster, streamlined process. And I think with this current administration, they are looking into streamlining things, making it a little bit faster, and, more belief in, holistic, natural ways of administering care and preventing diseases and stuff like that. So I'm very optimistic. In terms of, the socioeconomic barriers, I think that's a big one, right? Because we have these amazing therapies, but if we can't bring it to people, what good is it anyway, right? So we need to make it affordable. And for that, either the cost has to come down, or there has to be some way of administering care, maybe a nationalized healthcare system, or some provision by the insurance companies to discount the preventative strategies for patients to prevent developing chronic diseases, or have a reward system for the patients if they are maintaining a certain health score for a period of time, or they are showing improvement in health scores, things like that. So there are lots of these little nuggets that I have in the book that talk about, hey, legislators, look into this possibility, right? Hey, healthcare policymakers, here is something new for your healthcare providers. Have you thought about this? Or patients kind of know about this, so you can bring it up at the point of care. And this all insulated from a patient who actually had called me, and that's how the book starts, several years ago, for a treatment that he himself found and sought out, rather than the entire team of doctors who actually failed to bring it to the patient. So I'm like, we really got to nail this, but I'm glad it's here now and people can read about it, and that's how the book starts. So I'll leave it with that, a little suspense there. But I think we have to do a lot in terms of solving the healthcare challenge in our country.
Yeah, and I think that one part of the thing for me is always like following the money. And, there's so much money in medication and just medicating someone, right? Instead of preventing that they'd rather, sell someone medication for their whole life. And if that's so there needs to be like a whole framework shift of that's not in the best interest of society. Right? And will there be legislative change if the big pharma is the one who can influence the lobbyist? Right. So is there any lobbying going on for preventative medicine and kind of other things that you're working on? Is there any group of people or doctors that are binding together to try to make this change at a more political level?
Yeah, we have written guidelines. We have done some advocacy through American Society of Interventional Pain Physicians as well as the World Institute of Regenerative Medicine. There are other groups like ours as well, and there is a lot of activity happening globally now. For example, in Dubai, just recently declared it being the premier center for longevity services. So that's been flashing in the news recently, and it's just from last week. Also, in the United States, Florida and Utah have approved stem cell therapies for patients. And so things are moving in the right direction. But you're right. I mean, there are strong bodies that may not see this as, as something that's favorable, especially the pharma companies or hospital bodies where surgeries are done and so on. But I do strongly believe, although these therapies are very useful for patients and forward-looking therapies should prevent the diseases from coming on, and that's the stand we need to take, there are going to be a subset of patients who are going to need surgeries, and there are going to be people who are not going to need medications. We just have to strike that balance. And I think in our hearts, we have to know that, yes, we may have our self-serving interests and profits to make for the company, but at the end of the day, if we develop healthier community, I think we all win. So that's the stand I've sort of taken in the book. And I think there is something for everybody in terms of even the pharmas and so on. Pharmas can actually start focusing on drug development for, preventative therapies. There is a lot of work that needs to be done, or biotechnology, and a lot of pharmacs actually have shifted to, stem cell products or regenerative medicine or even biotechnology products that are more on the preventative side. And then, so much has to be said about people needing all types of care. Like we said, it's not a cookie cutter approach. So there'll be enough business for everybody, but let's do the right thing. Let's prevent diseases from coming on, and let's create a healthier America, and for that reason, healthier world.
Absolutely. Question for you. So stem cells, so it makes me think, when my daughter was born, I saved her cord blood, right? I had it frozen because the word was that the cord blood is very powerful. There's stem cells in there, and that if she ever needed to grow an ear, or I don't know what she would do with it. But so when you're talking about stem cell therapy, are they using that person's stem cells, or can someone else's stem cells be used to treat someone else? I mean, how does it exactly work with sharing stem cells?
Great question. So in the United States, except for the two states I mentioned, allogenic stem cells, which is using from somebody else's body or from cadaver, is not legal. So you can only use same patient's stem cells, called autologous stem cells. So my work is mostly with spine and joints. So I actually draw the stem cells from the patient himself or herself through their hip bone, called iliac crest. Mm-hmm. So we harvest that, we spin it in a centrifuge. FDA has guidance on that it has to be minimally manipulated and it has to be used for the same purpose, called homologous use. So we follow those guidelines and we administer that way at the point of care. Having said that, we have a couple of studies that are running overseas. There is a very interesting study that we are doing in Brazil that actually is looking at spinal cord injury patients, and we are using also patients' own stem cells, but people, who have had spinal cord injury from an accident or a trauma, who have not been able to walk or move their arms and legs, have shown some very positive results, even with a smaller dose or a few injections, even if their injury has been years old. Wow. So we are seeing some very positive response, and that needs to be studied more, of course, but very promising results there. There is another study we are doing with expanded cells or different types of cells in Southeast Asia. So there is a lot of work happening overseas, and my goal would be to be able to bring all of that to the United States under FDA guidance in clinical trials. So we keep it safe for everybody. But one thing that really bothers me is when people travel overseas to get treatments when they should be available here in the United States. Here we can control the quality, we can control how we administer care, and I feel we are really at the cutting edge, and we are premier country to be able to bring this to people, right? People look up to the United States as a developed country that has the best of everything. But regenerative medicine is where we lack because of all the things we talked about. And my goal would be to be able to bring these emerging technologies and imaging therapies, especially with stem cell regenerative medicine, to United States through FDA guidance and so on. So.
Yeah, I think that's really interesting. I think, so one more question I have for you is on pain management, because it makes it kind of back to what we were talking about. It was interesting when we had that whole, I guess maybe it was 20 years ago now, the opioid crisis, and now, they're not administering that to people anymore, which is good unless they really, really need it. So what are some of the pain management strategies that are coming out now that you're working on?
Yeah, absolutely. So, pain management has to be multidisciplinary in nature. That's rule number one. It can be just medications or it can be just procedures because, when you talk about chronic pain, it's a disease syndrome. Literally, it's not just a condition that is just a nerve or a disc that's a problem, right? Or a joint that's a problem. It takes over the entire life of a human being, and not just his or her life, but also the life of people around him or her, right? So it has to be multidisciplinary. So there are multiple tools. Of course, opioids are useful in certain circumstances, but not always. And we have to administer it carefully given the risks of addiction and substance use and so on that we worry about in people. There are interventional procedures, some of them very long lasting. For example, implantable neurostimulation devices where we can target the nerves or the brain or even spinal cord area to decrease the perception of pain. It works via something called gate control theory, where we are creating enough sensation of what we call as proprioception, so that the painful sensations stop going through that channels of spinal cord. So that's one, neurostimulation devices. Then there are, of course, PRP and corticosteroid injections that can be done. There are also ablative therapies where we can freeze or burn the nerves. So only certain types of nerves can be done, can be treated with that particular modality, but nevertheless is available. And then, we combine all of these strategies with physical therapy to get the function up, and meditation, cognitive behavioral therapy, nutritional management of pain. There is so much. I mean, in terms of just overall lifestyle behaviors that play along with all of these Western strategies to get the person to be most optimized and functional.
Absolutely, yeah. I think physical therapy is really, it's incredible how helpful it can be. I had a hip replacement 2 years ago. I know I look young for one, but I had an injury when I was young, running in a race, and it's debilitating when you can't even walk up 3 blocks without being in agony. It is really, it does impact everyone around you, 100%.
Yeah, I strongly believe, the bottom line of any treatment should be maximize the quality of life, right? That's exactly what we do every day. So give people the best life possible.
So I think that's all my questions for you. What's next for you? Are you going to be doing anything? What are you working on today?
Yeah, I'm working on making our protocols, stronger and better and more robust. I'm working on tracking our outcomes. In fact, we are opening our second office. We are very excited about that. I'm working on my book on longevity medicine. So that should be coming out hopefully in 2027, which will go over all the scientific background on behind all the longevity practices that we have and what can people do to live healthier longer. So really exciting times for us. I'm also working on a couple of clinical trials that we are launching with regenerative medicine, stem cells, and PRP, looking at vagal nerve stimulation, the growth factor type of studies that we are planning to do as well, and really honing in on making sure that patients with neurocognitive decline or cardiac conditions and just overall metabolic health are doing the best they can. So definitely the focus is on clinical care, making sure our patients stay as strong, live healthier longer, but then also launching some cutting-edge clinical trials and the longevity book. Hopefully that should be enough for this year.
That sounds like a lot. You got a lot going on. So, and how can people get a hold of you if they want to learn more?
Yeah, I'd love to have people go visit my website. It's annunavani.com. Even if you Google my name, it should show up. And yeah, my practice is called Reve Health Institute, and you can reach us by just putting that name, and it should come up. And also, we have a phone number. If you are listening, then I will give you the number right now, and just hang on a second. I wish I would have memorized it, but here it is. It's 408-888-2531.
Awesome. We're going to put all that information in the feed right here from Dr. Navani. So thank you so much for being here today. And to all my listeners, please join me next week as I interview another industry expert in topics to help you succeed on and offline. Big mahalo to all my subscribers. We just reached 200,000, and it is because of you and your aloha. So please share this content with your friends and family so I can get more great guests like Annu on to share their wisdom with us. And I will see you next week in the Pixels. Aloha.
Mahalo, Anna. Thank you.
I hope you enjoyed this episode of the Covert Code Podcast. If you're loving the insights we share here, don't forget to follow us on your favorite podcast platform and leave a review. Your support helps us reach more digital innovators like you. Share this episode with your friends and colleagues on social media and help spread the word. And if you're in the solar space or just curious about where clean energy is headed, I'm thrilled to announce my brand new podcast, The Solar Coaster. This show digs into the real stories, trends, and challenges of the solar industry, with bold conversations and powerful takeaways you won't hear anywhere else. Follow The Solar Coaster now so you don't miss a single episode. Thanks for tuning in. See you in the Pixels. Aloha.
Hi, my name is Robinson Aquino. I'm the author of The Small Business Money Game, the hidden strategies that turn survival into scale. And I'd like to tell you a little bit about why I wrote this book. Growing up, I was an avid fan of Monopoly. I like to think that I was the best player in our house, but my brother Alex dominated the board whenever he could. And it was one of my first early lessons in economics, what taught me that a game that should be fair, where we all start with the same assets, where we all earn the same income, quickly turns into a game that is quite unfair, a game where the minority owns all of the assets. And as I studied finance and economics, and as I spent the last 12 years working with entrepreneurs, I've learned this money game that we call business is very similar to that little game of Monopoly. In this book, I've written strategies on how to price, on how to manage costs, on how to scale businesses, and more importantly, where entrepreneurs consistently get stuck. I look forward to hearing your thoughts. Game on.